Sarcoidosis is an inflammatory disease that affects more than one organ system, but most commonly affects the lungs and lymph nodes. It is treatable, but there is no cure. It is not contagious, it is an autoimmune disease, and the cause is unknown. While there are many theories as to what causes it, years of research have not provided many answers. There are several suspicions, but similar to most autoimmune diseases, nothing concrete has been discovered. Some possible triggers include viruses, bacteria, environmental substances, and there has been some promising evidence that supports genetic markers for leukocyte antigens. It is found all over the world, affecting more women than men, and in other countries it seems to target a larger number of the Caucasian population, while in the US it's more common in African Americans. It is commonly thought of as a disease typically affecting the younger population, but studies have reported nearly 30% of patients are over 50 years of age. These studies often include an age range of 25 to 78. Symptoms can appear suddenly or develop over time. Symptoms showing definite lungs involvement include a dry cough and shortness of breath. There are a few symptoms that give a clue whether the disease will be acute with little lasting effects or if it will be chronic. Sudden onset symptoms include fatigue, fever, and weight loss, while the symptoms indicating long-lasting disease are shortness of breath and skin issues. Some more generalized common onset symptoms include red, rash-like bumps on or under the skin, enlarged lymph nodes in the neck, chest, armpits, and groin, red, teary eyes, blurry vision and stuffy nose, and swollen, painful joints. Some of the more serious symptoms are painful cysts on the bony prominences of the body, kidney stones, arrhythmia, which is an abnormal or missed beat of the heart, pericarditis, which is inflammation of the pericardium, seizures, and several other psychiatric issues, including dementia and depression. The inflammation from the disease causes granulomas to form on the body's organs. Granulomas are small bumps on tissue and can change both the structure and function of that organ. Some people who experience the sudden onset symptoms often have Lofgren syndrome as well, which is a form of sarcoidosis in the lymph nodes and causes nodules under the skin and arthritis pain. This goes away on its own in nearly all the patients who have it. Sarcoidosis also often causes pulmonary hypertension as a complication in both those with near normal lung function and those with diminished lung function. The figure to the right shows severity of pulmonary hypertension in patients by taking the mean pulmonary artery pressure in relation to forced vital capacity. There are 5 stages of sarcoidosis. The stages are based on the location of the granulomas and are found by doing a chest x-ray, as this is the easiest way the granulomas are able to be seen. Staging only refers to the areas in the body that are affected, rather than the advancement of the disease. This figure shows 4 of the 5 stages of sarcoidosis. Stage 0 is not shown because at that stage there is no sign of granulomas in the lungs or the lymph nodes. Stage 1 shows lymphadenopathy, which means swollen lymph nodes, meaning the granulomas are only present in the lymph nodes. Stage 2 shows both lymphadenopathy and pulmonary infiltrates, which means a substance that is denser than air shows in the lungs, and this means that granulomas are present in both the lungs and the lymph nodes. Stage 3 shows pulmonary infiltrates, meaning granulomas in the lungs only. Stage 4 shows pulmonary fibrosis, which means damage has scarred the lung tissue. This damage is permanent, and the stage is not reversible. This image shows a slide under a microscope of a biopsied lymph node infected with sarcoidosis. If this were the only way sarcoidosis could be diagnosed, it would often be misdiagnosed as tuberculosis, as the histology of both diseases is nearly identical. Treatment for sarcoidosis is approached on a patient-to-patient basis. Treatment is symptom-based, and not all treatment involves medication. Once a chest x-ray has been done, then a forced vital capacity is measured to assess the severity of lung disease. Some patients only need serial chest x-rays as long as they remain asymptomatic. Often, oxygen therapy is necessary, sometimes chronically. When medication is needed, a glucocorticoid, such as prednisone, is usually the first to be prescribed. If symptoms improve, the dose may be tapered and gradually a person may be weaned off. Unfortunately, many people require long-term treatment with medication, so an alternative immunosuppressive drug called methotrexate is substituted, as its side effects are not as harsh on the body. As with most autoimmune diseases, many of the drugs used to treat sarcoidosis were created for an entirely different purpose. These treatments can change to meet needs as symptoms change. Since there is no known cause, there is no way to prevent this disease. It is treatable and possible to live with sarcoidosis. Less than 5% of people with sarcoidosis die from complications of the disease. Short-term remissions can be accomplished, but generally symptoms will return at some point once treatment is stopped.